thank you and welcome to this information session presented by SafeWork SA and SA Health. Don't invite lead into your home. My name is Katie Geszner. I'm an Education and Engagement Advisor here at SafeWork SA, and I'll be hosting today's webinar. So this week is actually International Lead Poisoning Prevention Week, which is a week created by the World Health Organization to draw attention to the health impacts of lead exposure. To coincide with this important week, today's webinar will discuss the science behind lead exposure and talk about ways to reduce the risk of exposure at home and in the workplace. Also tying into this webinar is the release of 2 new resources developed by SA Health in consultation with SafeWork SA, discussing the harmful effects of take-home lead and how to prevent lead from entering your home. And so we hope that by the end of today, you really understand the risks of lead exposure in the workplace, and you can take some steps to ensure that this substance does not enter your home. Before we get started, I would just like to take the time to respectfully acknowledge the Geszner people as the traditional custodians of the lands on which we meet today, and the Aboriginal and Torres Strait Islander people listening to this session. So we pay our respects to elders past, present and emerging, and recognise and celebrate the diversity of Aboriginal and Torres Strait Islander peoples and their ongoing cultures and connections to the lands and waters of South Australia. So I'm now going to introduce our presenters today. So first, we have Dr. Peter Geszner. So Dr. Peter is a specialist occupational and environmental physician working in a private referral-based practice. So welcome, Peter. Thank you for being here today. Next, we have Razia Zarif. So Razia is a Principal Scientific Officer in the Public Health Division at SA Health. She has worked in lead exposure management in South Australia, as well as the Port Pirie program since 2008. So welcome, Razia. Thank you for being here. And finally, we have Ryan Jakowski, who's the occupational hygienist in the work environment team at SafeWork SA. So Ryan has a bachelor's degree in medical science and an honours degree in biomedical research. His work has involved researching worker exposures to hazardous chemicals, conducting air monitoring in mines and quarries, and now regulating businesses' exposures to a myriad of hazards. So welcome, Ryan. Thank you for being here today.
Thanks for that, Peter.
So just a quick overview of what will be covered in today's session. So firstly, Peter will go through the health effects of lead, how humans can get exposed to lead, and how you can find lead in the body. Then Razia will discuss best practice for minimising exposure to what we're calling take-home lead. Next, Ryan will discuss what the WHS regulations state businesses must do to protect their workers against lead, as well as what the regulator expects from businesses. And then finally, at the end, we will have a little bit of time for a Q&A session where we will endeavour to answer some of your questions. So please stick around if you do have any questions to ask those at the end. To ask a question, please put them in the Q&A tab. So you can see at the top of your screen there's a Q&A tab. Put any questions in there, and once we get to the Q&A section, we'll have a look in there and answer your questions. Just a couple more housekeeping things before we get started. This webinar will be recorded and it will be uploaded to our YouTube channel shortly after this webinar has concluded. However, the slides themselves will not be available. So slides will not be available, but there will be a recording available on our website or on our YouTube channel. I'm now going to hand it over to Dr. Peter, who's going to begin by talking about the health effects of lead. So over to you, Peter.
Thank you for that. And look, I'd just like to welcome everybody here today. So I'm going to talk generally about the health effects of lead and just sort of walk through exposure pathways, how the body handles lead, and talk a little bit about lead testing and what the numbers may mean. So if we can have the next slide, thanks. So this slide speaks to the pathways of lead absorption for the body. And so you can take in lead by breathing it in, by eating it, and you do get lead absorption through the skin or transdermally. And so, look, skin absorption by and large isn't particularly important for the vast majority of lead exposures, and mainly relates to organic lead compounds. And these were used, for example, in leaded petrol. This is pretty uncommon, so I probably won't talk very much about organic compounds and exposures, but just to note that they are different, they are well absorbed through the skin, and their health effects are actually somewhat different. So in the majority of exposure scenarios, we're dealing with inorganic lead. And look, outside of the workplace, exposures can be through the ambient environment or through the diet. And by and large, since the removal of lead in petrol, diet's become more important, ingestion has become more important than inhalation. So that may change depending upon your proximity to industrial sources. In the workplace, inhalation tends to have a dominant effect over ingestion, but it depends upon the work that's involved. Lead is well absorbed by the lungs and the gut, and it simply piggybacks on those efficient systems that the body has to take in nutrients, particularly calcium and zinc. For the lead that we breathe in and get an exposure, it depends on the activity undertaken. And look, examples here on the side, you can see this person here is sanding some white paint. Before the 1970s, you could go to the hardware shop and you could go and buy white lead paint for your home. The lead there was used as a pigment, and about 40% of lead by dried weight as its content. You can grind and saw lead-coated materials. This can include some plastics, some technical coatings. What was commonly used was red lead paint, which was applied to bridges and trailers because of its anti-corrosive properties. That lead concentration in that was actually higher than in white lead. The commonly anticipated activities, working directly with lead sheeting, where you might have surface heating, melting or smelting or sawing or grinding. So these activities again can generate particulates that you can breathe in, or possibly lead fume. Lead has a low melting point, 327 degrees. It's why it's particularly kind of usable as a material. If you're soldering, the temperature's about 340 degrees, though you don't tend to get lead fume until you get to about 400 degrees, and not quite so much, but once you start to get above 500 degrees, then the lead fume concentration increases. And for a whole sort of series of activities that we can do, we put lead into the environment. And so when we kind of clean up and sweep, we sort of generate dust. So when it comes to inhalation, you can have rather large particles. Most of these will deposit in the nose and the upper airways, which you then swallow. But for very fine material that gets right down into the air sacs, absorption approaches around 40%. So for very fumes and very fine particulates, absorption becomes significant. Ingestion is probably the most significant pathway for people that are outside the workplace, and in the don't take it home message, it's kind of bringing things home to contaminate the home environment. And on a daily basis, we take in lead from our diet, including very small amounts in the food chain, and also very small amounts in the drinking water. And in the drinking water, it's contamination at source, but it's also brass in the plumbing fittings, the use of lead in solders and so on. Hand transfer is an important pathway for ingestion. Simply lead contamination on the hands. We frequently touch our mouths, and again, the body's very efficient, very capable of absorbing small amounts through hand transfer. So hand hygiene becomes important. Cigarette smoking, there's a small amount of lead within each cigarette, so there's inhalation, but it's also a very significant contributor to hand transfer exposure. Right down the bottom here, we have a picture of a toddler, and toddlers have a hand-to-mouth existence. And so anything that's on the floor, anything that's in the yard, anything that's in your pot plants, the cat, toys, chunks of paint, are ready opportunities for absorption. The other particular aspect is for adults, we would probably absorb something in the way of 10 to 20% of a dose. For toddlers and young children, that approaches more than 30%. Next slide, thank you. How is lead distributed in the body? And this is the simplest possible model. The complex models have 7 or 8 compartments and different equations for children versus adults. Essentially, the lead you take in the body goes into the bloodstream. It gets incorporated into the red blood cells, and it's taken by circulation to the body organs. The half-life of lead in blood is pretty short. So for any given exposure scenario, about half of that exposure will clear in around 30 to 40 days. There is also lead just about in every biological tissue. And so the half-life is slightly longer for things like muscle and organs. However, the most significant area, or the most significant part of your body burden of lead, is in the skeleton itself. And so about over 90% of your total lead burden resides in the skeleton. And it has a much longer half-life, somewhere between 2 and 30 years. And from the arrows here show that the rate of lead moving from the blood to the skeleton is just that bit faster than the rate of lead moving from the skeleton back to the blood. And this shows that, you know, we are almost universally in a slow accumulation phase of lead exposure during our lives. And so, you know, if we were to do a chart of blood lead over life, we would see that you're born with a particular level, peaking at about the age of 2, again with that hand-to-mouth existence, and then dropping during the course of your teenage years, and then slowly increasing during adult life. Mainly, lead is excreted through the kidneys. There's a small amount that gets excreted through the bile and down through the gut. Next slide, thank you. What are the health effects of lead? Lead is probably the most studied of all the occupational toxicants. And so, in fact, there's a very wide body of literature, and the health effects of lead potentially are extensive and potentially involve all parts of the body. Lead is a toxicant. It serves no useful biological function. And it impacts on enzymes, cells, messaging between cells, cellular functions that rely on calcium and zinc. It particularly likes to bind to sulfhydryl groups, interferes with how calcium and zinc works through the body. The most vulnerable group are young children, and as mentioned before, exposure really starts during the course of the pregnancy through the placental circulation. It's added to by breastfeeding, and also added to by the hand-to-mouth exposure in the home and general environment. And so, again, don't take lead home. This is really an important message to really protect your family. The health effects occur to the developing brain and to the nervous system, and are seen at studies at the population level. It's often difficult to pick an individual with a health effect, particularly at lower levels, and the effect is seen in reduced IQ and neurobehavioural effects in these population studies. Next slide, thanks. This pictogram comes from the National Health and Medical Research Council in 2016, and look, it's particularly complex, but on the left-hand side, it describes effects for children, and on the right-hand side, it describes effect in adults. The up arrows are an indication of where threshold of effects are likely to occur. So even though there are threshold effects, it's not a certainty that your kidney function will be affected at this level or your blood pressure will be that, but it's an indication that that effect is possible. And we often see people with levels at the 20 and 30 microgram per decilitre, and it's difficult to actually identify a particular health effect. So at the lower levels, we can measure the impact of lead on various enzymes and various enzyme pathways at low levels, particularly readily apparent on how the body makes hemoglobin, which is the red stuff in red cells that does the oxygen transfer work. And that's, but as levels start to get higher, and certainly once we start to get above 10 micrograms per decilitre, measurable effects and possible effects start to become more evident. And there are a number of different ways that lead can cause harm. And firstly, there are common diseases involving the kidney, high blood pressure, cardiovascular risks, and it could add to the severity or add to the impact of underlying conditions. And then separately, it can de novo or directly cause health conditions. So this includes increasing blood pressure, effects on the gut, effects on the kidneys and kidney functioning, effects on the peripheral nervous system. So in other words, those nerves that go to supply the muscles and the sensation of the arms and legs, effects on the central nervous system, so effects on the brain, on thinking, concentration, cognition. Very rarely, and I have to say I surveyed some of my colleagues to whether or not it's seen these more severe effects, such as occult brain disease, encephalopathy, or coma, or lead colic, but look, certainly severe severe disease statuses and death can arise from very high levels of exposure. But there are also reproductive effects. These include in males and females, where fertility is reduced, time to pregnancy, reduction in sperm counts, but also potential effects on a range of reproductive outcomes. Lead is considered a class 2B carcinogen, so there's some animal evidence, some possible human evidence. Look, there are some conflicting studies. It's not entirely sure which organ types are dominant. The degree of risk and the degree of certainty isn't at that level that we have with things like asbestos, or with cigarette smoking, or ionising radiation, or with alcohol. So next slide, thank you. So how and why do we measure lead in blood? And the testing for lead is pretty straightforward, and providing accredited laboratories have quality assurance processes for this, and it's actually rather important that it's actually done in an accredited laboratory. The measure that we use is a rather simple measure, as mass per decilitre, and sometimes we might use a concentration measure. Why do we measure lead in blood? This is the most studied. It is the dominant measure that we would use to monitor exposure and to consider health risks. There are a number of drawbacks, and if we go back to that slide where we had the half-life, it only reflects more recent exposure. So look, it helps us perhaps understand what's happened in the last month or two, maybe the last few months before that. The bone stores make some contribution to the blood lead. So it is an imperfect measure, but it is the measure that we know most about, and it's the measure that is most used. As I mentioned, it's readily available, but it's not a routine test. And so you don't say, well, okay, test me for everything, doc. That won't include a lead test. So look, it has to be requested. And so I'd suggest that, if people have a concern, and that concern might just be, I've been doing this, have I got a significant exposure or not? Or I've got a concern that I've got a condition that might relate to lead exposure. Blood lead levels won't tell you if your condition is or isn't related, and this will need a much more detailed clinical assessment to relate health effects, include taking an exposure history, perhaps considering additional investigations, and putting the whole picture together. The other value about measuring lead is that, look, repeat measures can be helpful to, one, confirm the first result, because that's important, and secondly, looking at identifying trends and also controlling lead exposures in the workplace. Next slide, thanks. This comes from a community sample in Victoria, and in yellow we've got some of these units highlighted. So just a couple of simple sort of messages from this. And firstly, look, most people had some lead detectable. In men, about 95% tested below 5 micrograms per decilitre. And for women, that was around 98%. The average in this population was around 1.4 micrograms per decilitre, and we pretty much line up with US and Canadian ones in that little corner slide there. Interestingly, the average in France was somewhat higher, and the last little fact to be gleaned from this slide is you can see that just older people have higher levels than younger people. So next slide, thank you. So numbers and guidance. National Health and Medical Research Council in 2016 put forward 5 micrograms per decilitre as an action level. And as you can see from that slide before, most people, but not everyone, will be below that on testing a community sample. And what is recommended is that if you're around this mark, and to be fair, if it's 4, I don't think this is unreasonable to take the same approach, is it creates that opportunity to have a look at, hey, what are the sources of lead exposure? What can I actually do to reduce that lead exposure? And to be fair, I mean, you could be the sentinel person in in a workplace or in a domestic environment, and so it's worthwhile taking a stepwise and logical approach to work out what are the sources of exposures and how can I stop or prevent or reduce those. Next slide, thank you. The other common scenario for testing lead is in workers undertaking lead risk work. And SafeWork Australia has a health monitoring guide for inorganic lead. And my 2 slides here are going to be gross oversimplification of what is really a very important document that outlines the obligations on workplaces, the need to have controls that operate to reduce exposures. Medical monitoring requirements to lead are an important part of a real system of control of lead at the workplace. And look, one of the first important things to note is that it does make the presumption that people are fit and well as workers undertaking this form of work. The guidelines are split into two groups. For females not of reproductive capacity and males, the important aspects here is one, having a baseline. Two, repeating that test about 1 month after starting work. This is the time when, if we look at safety research, it's new workers that are most at risk from chemical exposures and also from safety accidents and so on. And so this is an important checkpoint just to see that work practices are correct. And then monitoring is then contingent upon what the next test is. If the levels increase, then monitoring needs to be more frequent, and there also needs to be actions associated with this. And the removal level of work is at 30 micrograms per decilitre. So if we can just the next slide. And so for females of reproductive capacity, again, bearing in mind what the reproductive risk and the effect on the next generation here is from in utero exposure and from breastfeeding, the numbers are significantly lower. And so the action level is 10 micrograms per decilitre, but the target really is to be keeping them below 5 micrograms per decilitre. So significantly lower objective. And so for me, I think that's my last slide.
Oh, perfect. Thank you for that, Peter, for that really, really good explanation of those health effects, and definitely some interesting stuff in there. For me, I thought the fact that all of our water has a little bit of lead in it, I did not realise that. So thank you for that great information. I'm now going to hand it over to Razia, who's going to talk a bit more about take-home lead. Over to you, Razia.
Thanks, Katie, and good morning, everyone. I would rather say don't take home lead. So I'd just like to begin by, like Katie said, this is International Lead Poisoning Prevention Week, which is an initiative of the WHO. And every year, our team here at SA Health, we try and focus on different lead exposure sources in South Australia. So in the past, we've looked at lead-based paint, we've looked at complementary medicine, and this year the focus is on take-home lead. So what is take-home lead? It's the lead dust that people can take back home from their workplace or their hobbies. So our focus is workplace, but hobbies as well. And SafeWork SA, and I'm sure Ryan will talk more to it after me, regulates lead exposure in the workplace, whereas our team in the Public Health Division at SA Health, we focus on exposures outside the fence, so to speak, so community and home-based exposure. So whereas the source might be inside the fence, it's where the exposure takes place, so community exposures. So next slide, thanks, Katie. Before I go into take-home lead and talk more about it, I just wanted to let everybody know, like Peter's mentioned, the NHMRC guidance. So that's a guidance that most government and health departments follow. And the number that we use as a guidance value is 5. So NHMRC has put out a statement saying if anybody has a blood lead greater than 5 micrograms per deciliter, then they've been exposed to lead levels above what is considered background exposure in Australia. And the exposure source should be investigated and exposure reduced, especially if they're a young child or pregnant. So guidelines, values, and standards and all those things, they evolve over time. And next slide, thanks, Katie. And I'll be talking a little bit about what we've had and how it's evolved over time. So as more research and outcomes come into light, the guidance values have kept evolving. So back in 1981, we had a level of concern, which was 30 micrograms per deciliter, and that got reduced to 25 in 1987. And then there was another review in 1993 where a goal of 10 micrograms per deciliter was set. And then this most recent review in 2015, where we've got an investigation level of 5. And so we also keep an eye on movement internationally, on what other countries, other agencies are doing in terms of lead exposure, what is considered a value that people would adhere to, given what the most recent research has shown. And most recently, the US has come up with a reference level of 3.5. And so there's nothing stopping from another review of these happening in Australia as well. And so just to clarify, Peter talked a little bit about blood lead level numbers. They were more for occupational setting. The numbers I'm talking to you are for the general public, and that's to protect the most vulnerable, which is the young children and pregnant people. So next slide, thanks. So Peter's talked about the exposure pathways in occupational settings. Inhalation and absorption might be more dominant than in the non-occupational exposure settings. In fact, our team here at SA Health, we did a study in the early 2000s in Port Pirie, which is a site of one of the largest lead smelters in the world. And we found that at least 95% of the exposure for children is through ingestion. So apart from all the other things, the children are young, their brains are developing, they've got the hand-mouth behavior, which is natural, and they absorb more lead. They tend to also get exposed to more through ingestion overall. So that makes kids extra super vulnerable. The next slide, thanks. So let's talk about take-home lead now. So there's evidence from back in the 70s. This is not a made-up thing. There's evidence which found in the 70s that there were workers who had occupations where there was high lead exposure risk, who also had higher blood lead levels and higher dust levels in their home. So that suggested that the workplace lead was being transferred into homes. And it was mostly the younger children who were found to have the higher blood leads because of all the issues and the factors that we've talked about. And in Australia, the last major health survey looking at blood leads in children had found that occupation of parents was one of the factors that contributed towards increased blood lead levels in children as well. So next slide, thanks. Looks like the slides don't want to move.
Oh, can you see that? Does take-home lead evidence?
On my end, it's gone. I've got the wheel of death. That's okay. So take-home lead, this is the 2011, 2012. There was a study in Puerto Rico that showed elevated blood lead levels were found in more than half the children of families tested who were working in a battery recycling factory. And then there was another study in Michigan, 2015, 2016, where a third of the employees who had blood lead test and were working in occupations where lead exposure was a risk and who had themselves had elevated blood leads likely had children with elevated blood leads as well. So, and there have been many other studies, and I've just picked a few to just explain what I'm trying to say, but there have been many studies which have validated that take-home lead is definitely a thing. And while it is a well-known and a validated exposure source, it hasn't gone away. It's still there and continues to remain a source of lead exposure for the general public. So next slide, thank you. So yeah, take-home lead still happens, and the best way to minimize harm from lead exposure is to minimize exposure. So we've got 5 tips which can help reduce the risk of take-home lead. So people who have a who work in an occupation that has high exposure, lead exposure risk, or who have hobbies that are lead related, should wash and store their clothes and shoes separately. When you get home or before getting home, shower and change into clean clothes before you play with your children. Clean items that you take to work. So I know there's a big focus on the clothes and the shoes, but people forget you take your mobile phones to work, and that can also get contaminated. So cleaning those items, and kids usually touch them, is also really helpful in minimizing exposure. And some people have sheds in the backyard or sheds where they might be doing their business from, if it's a car repair business, for example, which is on their property at home. So just keep your family members as well as pets away from your work and hobby areas, because children, pregnant women, as well as pets, dogs and cats, they also get affected by lead exposure. And where possible, not using your work car to transport children. And I know a lot of us take our personal vehicles to work, so it might not be possible to not use, have a different work car and a different home car. And cars have been found to be a major source of take-home lead. It's easy to transfer the dust from your work into the car. If you leave your windows down, for example, and if there's emissions and dust blowing around, that can easily get into the car and contaminate the car. So, yep, the advice is regularly clean your car by wet wiping the surfaces, especially car seats, and vacuuming using a HEPA filter vacuum, because that tends to pick up the really small particles. Next slide, thanks. And yes, there's evidence to show that these measures, these tips that I've talked about, that they work. So there was a study by US CDC, EPA in 2010, 2011 that showed that having workplace shower facilities and shoe washers and educating workers helped reduce their children's blood leads. And then there was another study that just came out this year, which showed that contaminated work and hobby clothes can transfer the contaminated dust to other clothes if you wash them all together. So the advice is to wash them separately. To reduce the risks of take-home lead, I know businesses and hobbyists usually focus on, people who are your normal employees, or people who have been doing a lead risk hobby for a long time. They get educated about these things, about minimizing lead exposure. But if you have somebody who is a casual worker or a temporary worker, contractor, or who's somebody who's just rocked up once to a hobby session, these people usually don't get that information. So it's important that the information goes out to all the different kinds of workers and hobbyists you have out there. Next slide, thanks. So how do you know when to worry about take-home lead? So if you work in an industry where lead exposure is a risk, or have a lead-related hobby, so industries where lead exposure is a risk could be lead mining and smelting facilities, car battery manufacturing and recycling facilities. If you work in welding and soldering leaded steel, if you work with old lead-based paint, restoring cars and homes and boats, all those occupations are considered high lead exposure risk occupations. And then the hobbies, lead lighting, and then people who visit shooting ranges or who cast their own or make their own fishing sinkers. These are some hobbies that can increase your and your family's lead exposure risk as well. So I guess the message is, if you have a lead risk hobby or work in a industry where lead exposure risk is high, then you should aim to follow the precautions or the tips, even if your blood lead levels are low. because remember, yours might be low, but the children, your children at home, the ones you visit, they ingest and can absorb more lead, and their levels can easily go above 5, even if yours are not. So next slide, thank you. And so what should you do if you're worried about your family's lead exposure? The best advice is to talk to your GP. And like Peter mentioned before, they would most likely suggest a blood lead test, which would tell you if there has been exposure in last month or so. A blood lead test can't tell you where the exposure source is, so that needs an exposure investigation. And follow the advice that's provided in minimizing your lead exposure. So you're also minimizing your family's lead exposure, and the advice that's provided about minimizing take-home lead. Ensure that you and the children and all the vulnerable groups, they have a well-balanced diet. Sometimes having conditions such as low iron may increase the absorption of lead. So that's also something useful to keep in mind. A well-balanced diet helps. And the one question that we often get asked is, and this is from occupational exposure as well, is there a medication, is there a pill, is there something we can take to reduce our blood leads quickly? And the answer is no. The best way is to minimize or avoid exposure totally. At very high levels, and there's guidance provided by the NHMRC, there is a procedure called chelation, which can be done, but that requires specialist clinicians and toxicologists to undertake that procedure because it's not without risks. So, yeah, there is no silver bullet. You just have to find the source and avoid or remove the source if you're trying to minimize that exposure. And that's all the slides from me. I think I've got one more. If anybody's interested in any of the studies that I've briefly touched on, they're there. You could go and look them up. But like I said, there's lots and lots of studies on this. So thank you.
Thank you very much for that, Razia, and definitely some really, really good tips there for people to implement if they're if they are exposed to lead at the workplace. All right, and now I'm going to hand it over to our final presenter for today, which is Ryan Jakowski from SafeWork. So Ryan is going to talk a bit more about how lead risk work connects to WHS legislation and what businesses need to be aware of. So over to you, Ryan.
Awesome, thanks for that, Katie. I just want to say thanks to Razia and Peter as well for that really interesting information. Very helpful. Yeah, as Razia was saying, workers aren't the only ones affected by take-home lead, but in what I'm talking about now, hopefully that'll try and reduce it at point source. So yeah, in the following slides, I'm just going to cover some general information around the lead processes and lead risk work. However, I'm going to be mainly focusing on the regulatory requirements for the containment of lead. So yeah, the next slide, please, Katie. The regulations are quite prescriptive in terms of defining what a lead process is, to the extent where they contain about 18 examples of lead processes ranging anywhere from exposure to lead dust and fumes, battery manufacturing and dismantling, foundry processes, and so on. There is also an additional regulation at the bottom of this list, which allows the regulator to decide whether a certain process is a lead process if it's not listed specifically. So this is done with regard to airborne lead levels and blood lead levels of the workers. The next slide, please, Kevin. Now this slide, my colleague created. It's a really decent diagram. It shows a flowchart detailing the steps that must be taken once a lead process is identified at the workplace. But for the purposes of this webinar, I'm only going to concentrate on the regulations regarding the control of risk for lead, which apply to both lead processes and lead risk work. So going into the next slide. Just for the record, lead risk work is defined as work carried out in a lead process that is likely to cause the blood lead level of a worker carrying out that work to be more than 5 micrograms per deciliter for a female reproductive capacity, and then 20 micrograms per deciliter in other cases. However, what we're talking about today is required for both lead processes and lead risk work. So moving on to the next slide. So once a lead process is identified, information must be given to workers on the health risks and toxic effects of lead exposure, and controls must be implemented to contain lead at the workplace. So there's 5 areas which must be implemented by PCBUs, so person conducting businesses or undertakings, which mainly fall under the containment of lead, cleaning methods, eating and drinking areas, changing and washing facilities, and laundering, disposal, and removal of PPE. Also, let's go through these 5 in a little bit more detail now. So regarding the containment of lead contamination, there's a regulation that says a PCBU must ensure that contamination by lead is confined to a lead process area. This is a broad regulation that is somewhat self-explanatory. This could be interpreted as ensuring that the lead process area does not have the potential to spill into other areas that may not have adequate controls to deal with in controlling its lead. We've personally seen some businesses that use bubbling or plastic sheeting, especially in building environments, to enclose the area. Some negative pressure extraction systems with HEPA filters. We've also seen people use static monitoring around the perimeters to ensure airborne lead is confined to the area. We've seen bunting as a physical barrier for work that may be outside, and some signage as well, mainly just to make workers aware of the hazard, and in the case of lead processes in the public, just to ensure pedestrians stay away from the area and do not enter. So certain environments for lead processes can be challenging, but this must be done as far as reasonably practical. On to the next slide, please. Now, moving on to cleaning methods, the PCBU must ensure that a lead process area at the workplace is kept clean. Now, what does this mean? There are definitely some dirty jobs out there, but from what we've seen, there have been some PCBUs that have implemented something called sticky mats. These are to sort of capture lead contaminated dust in the bottom of boots. HEPA filtered H-class vacuums, so high efficiency vacuums with that filter that really filters out that granular sort of side of things. The use of lead binding wipes and soaps for surface and equipment cleaning, as well as mopping as well. There's also a few other additional requirements, including that the PCBU must ensure that the cleaning methods do not create a risk to the health and safety of persons in the immediate vicinity of the area, and do not have the potential to spread the contamination of lead. Now, some of the likely suspects that we've seen that have potential to spread contamination and create risk could be using compressed air to clean off lead dust, liberating that air that could be breathed in. Using high-pressure water cleaning, as this can also liberate dust as well. Low-pressure water cleaning could be a better alternative, and dry sweeping for the similar reasons. This can be addressed by static monitoring to ensure airborne lead is contained, and decontamination procedures to minimise the potential for lead contamination. On to the next slide, please, Paul. Now, going on to the prohibition of eating, drinking, and smoking in the lead process area. This addresses one of the main routes of exposure, which is ingestion, and in some instances, inhalation and absorption. Even though areas may not be obviously dusty, there can still be a risk of lead exposure by eating, drinking, smoking, chewing gum, as anything that sort of goes into or near the mouth could be contaminated with lead and absorption and digestion. So not to mention contaminating objects and taking them home could contribute to take-home lead. So the PCBU must take reasonable steps to ensure a person does not eat, drink, chew gum, smoke, or carry materials used for smoking in a lead process area. Something we've seen this in workplaces where workers would have lockers just to store some of their belongings before entering the lead process area, such as personal mobile phones, such as a personal drink bottle and whatnot. We would also look for workplaces to have systems of work, just to ensure that there are some systems in place and that workers are aware of these requirements. And we've also seen an example of some sort of lead visualization technologies as well, some sort of chemical reaction that happens where lead can sort of fluoresce and show you if decontamination has occurred appropriately before exiting the lead area. And following on from this, the PCBU must provide workers with an eating and drinking area that cannot be contaminated with lead from a lead process. Now, this is somewhat self-explanatory, but we've seen just separate areas in the lead process area where decontamination is required before entering, and just areas clearly marked out on site plans of the workplace just to ensure that everyone's aware. On to the next slide, please, Ben. So on the provision of changing and washing facilities, the PCBU must also provide and maintain in good working order changing rooms and washing, showering, and toilet facilities at the workplace so as to minimise secondary lead exposure from contaminated clothing and minimise ingestion of lead and avoid the spread of lead contamination. The PCBU must also ensure that workers removing clothing and equipment that is or is likely to be contaminated with lead wash their hands and faces before entering an eating or drinking area. So we've seen some other good examples as well, where there have been separate workplaces where there's been separate in and out entries for decontamination zones, just to ensure that workers are not trekking back through their lead once they're decontaminated. Disposal of PPE will be designated areas such as laundry baskets and bins, and then they go off and contaminate. And as it sort of says, hand washing facilities, just to address washing exposed areas of the skin before entering the eating or drinking area. Oh, next slide, please, Penny. Now, one of the last ones, there's some regulations about laundering, disposal and removal of PPE. So this can be quite variable. So for disposal of PPE, a PCBU must ensure, for disposable PPE, a PCBU must ensure that PPE likely to be contaminated with lead is sealed in a container before being removed from the lead process area and is disposed of on the completion of the lead process work at the site equipped to deal with lead contaminated equipment. So for non-disposable PPE, this could be an example of reusable overalls or work clothes. They must be laundered at a laundry, whether on-site or off-site, equipped to launder lead-contaminated clothing, or, if this is not practicable, to keep the clothing in a sealed container until it is reused for lead process work. If it is not reasonably practicable to dispose of PPE that is not clothing, so for example, reusable masks and goggles and whatnot, just to ensure that PPE is decontaminated before being removed from the lead process area, or if it's not reasonably practicable to decontaminate the equipment in the lead process area, to ensure that it is kept in a sealed container until it is reused for lead process work. So now the PCBU must ensure that the sealed containers are decontaminated before being removed from the lead process areas, and they must also ensure that contaminated clothing is not removed from the workplace unless it is to be laundered or disposed of. So those are the sort of main regulations just around the contamination of lead and controlling against that. There's a few other regulations, but those sort of fit the bill of what we're talking about today.
Oh, perfect. Thank you, Ryan, for that. And more information about any of these regulations are available on our website. And I might just pop up this great flow chart again for a few seconds if you want to take a picture of it. That's a really good, I think, representation of all the regulations in there. Okay, we're now going to move on to our Q&A section. So if you haven't already, please pop some questions through on the Q&A tab, and we will try and answer some of your questions. So just to start with, and this is a question, I guess, for potentially for Peter and Razia, or potentially Ryan as well, so whoever wants to chime in. Look, if my test results, if they show more than 5 milligrams of lead per microliter, who do I need to talk to? Where do I go?
Yeah, but firstly, that's actually a really good question, because knowledge around the health impacts of occupational toxicants and leads isn't very widely known. and how to work your way through an exposure history and know what things are relevant is, look, it's a skill. So, look, firstly, 5 micrograms per deciliter, not milligrams. I'm a bit worried about milligrams. Look, firstly, talk to your doctor. And if a test is increased, probably the first thing to do is actually just repeat the test, because you actually learn something from a couple of tests a while apart. And look, sometimes there are factors in collecting a sample that lead to contamination, and right down low there's a little bit of laboratory kind of variability. But look, who could you talk to? And look, you can certainly talk to occupational physician, public health physician, but also there are a range of public health practitioners, and you look, people in the public health area who aren't medicos often have a lot of experience as to what workplace environments are like and what it's like to do a field investigation at a kind of home. So the solution's a little bit kind of shared around as far as very small group of medical doctors that can be helpful, including the toxicologist, but also a wide range of allied health professionals that can kind of help you work your way through things.
And if it's not an occupational exposure, if it's the general public, then you can contact our team at Public Health, and we can help. Like I was mentioning before, it's all about exposure investigations and then trying to find out the source and then addressing that. So we help the general public in that space. And in South Australia, elevated blood leads are not yet a notifiable condition, whereas in most other states and jurisdictions it is. So there's that, but we still help out, and we get numerous notifications from labs just because of habit, and we get calls from doctors when they get levels over 5, and we pitch in where we can.
Cool. Thank you, Peter and Razia. We've got a few questions that have come in now. So first one, I work at a university that teaches creative arts, including pottery, plaster, glazing, and glass blowing. We haven't done any testing for lead exposure in this area. Is this something we should consider? Is there any specific materials or compounds that are used that we should be checking for in particular?
Yeah, I can jump in on this one. So it's a bit hard to say, you know, without being sort of privy to the details. But yeah, if you sort of look at some of the things that you're using and they contain lead, it could be worth considering to get further testing done as well. So, and also I guess just sort of looking at in regulation sort of 392 specific that sort of falls under the process and whatnot. But yeah, there are certainly businesses out there that can consulting services to sort of help to identify that sort of thing.
One of the sources, and that's, look, if it's available, material safety data sheets. And so, look, you know, there should be information about the things that you use. They're not always reliable, because there are certain countries that tend not to necessarily include all the relevant information. But you know, that's a thing that you can at least readily assess. And you know, there's some interesting things about surface testing with little things that will glow that or fluoresce when they've got lead. I mean, in theory, you know, look, pottery for things for human consumption should actually be lead free. I think that's a requirement, but it's unfortunately not always the case.
Well, thank you, Ryan and Peter. We've got a couple more questions. For any of you, I know we're coming up to 11 o'clock now, so if any of you do have to dash straight on 11 o'clock, I've just popped the slide up here with our information if you've got any further questions, but I'll go through that a bit after, but in case anyone has to pop out. So this one is for Dr. Peter. So Dr. Peter has mentioned hypertension and kidney disease in lower lead levels in the adult population. There was no information on that slide regarding pediatric kidney disease. Is it not studied, or is it adult related? Is it part of the monitoring response to evaluate for hypertension and kidney disease with high levels in paediatricians? So yeah, just asking about, I guess, the connection between.
Look, my apologies. I'm an occupational physician, and so very strictly I deal with workplaces and adults, and so my knowledge in the paediatric population is look incredibly kind of limited, and it's often difficult from an occupational and even general epidemiology perspective. It's often difficult. You can pick out a signature, but it's sometimes difficult to pick that out at an individual. And I think you've just got to assess the patient as you see them. But I can't offer any more detail than that.
No worries. Thank you, Peter. Okay. And then we have got one other question. And this one's more for Ryan. In the absence of any state or national standards for lead in dust, what would you advise to go by for removal of lead dust in a commercial environment? And so this person said, some hygienists have adopted international standards, however, they are not applicable to SA. Other hygienists go by their own adopted levels. There's no real clear guidance I can find.
Yeah, so you're right. There's not guidance, at least that I'm aware of, that can adequately sort of determine that sort of thing. There is an exposure standard for lead in dust, so airborne lead at 0.05. You can measure that. If you do some personal dust monitoring, that could be something to consider. But I'd like to draw some attention to Regulation 402 in identifying some lead work and whatnot. So it says that you should have regard to past biological monitoring results of workers, any sort of airborne lead levels, the form of lead used, the tasks and the processes required to be undertaken with lead, the likely duration and frequency of exposure to lead, and possible routes of exposure to lead, and any information about incidents, illnesses or diseases in relation to the use of lead at the workplace. But yeah, just from our experiences and previous health monitoring reports has been very useful in determining what should happen. But at the end of the day, if it's a lead process, there are still controls that have to be implemented to control the risk of exposure to lead. That's whether it is lead risk work or whether it is lead process. So lead risk work differs where you have to get health monitoring. But yeah, those controls still apply to whether it is a lead process or lead risk work.
Thank you, Ryan. We've got one more question here, and I'll read it out, but we may have to maybe get back to this person, I think, after the webinar. Due to lead accumulating in bones and tissues, how reliable is blood testing for monitoring workers, and how can we use this data to implement effective corrective actions?
Look, firstly, that's actually a big question. Blood in measuring lead in blood is our best measure, and it's the most widely applied measure. But it has some limitations because mainly it looks at the short-term storage compartment in the blood and the soft tissues, and so this is probably looking at around 2 to 3%, 4% of the total body lead burden. And in a sense, when you do a test, it's more of a snapshot in time, and people's exposure histories are far more complicated. We talk about that journey over a lifetime, but equally, what's actually happening over a shorter period of time. And for example, if you're testing every 6 months, you might miss peaks and troughs with regards to someone's exposure. It doesn't give us a measure of the sort of body burden in bone. You need very special kind of technology for that. It's called X-ray fluorescence, which you don't actually have a unit in there. There is some research, but the big volume of research is around blood lead level. Is it effective? Oh, look, it's highly helpful. and it's highly helpful, I think, in a few ways. One is, look, a workplace gets to see the levels, but also a worker gets to see their levels. And then there's a discussion around controls, and you have an obligation on the employer, but you also have an informed worker who has additional reasons. You know, I want to get my lead level down low, and you know, companies can use group measures and can set group targets, and so in a way that it facilitates active exposure reduction. I think it would be a poor practice is if you are relying on 30 micrograms per decilitre as your sole management kind of strategy, but it has some limitations, and those limitations relate to how well it assesses exposure, how well it reflects the sort of body burden, and you know, is it the best surrogate for health risk? Well, I think we're going to find, you know, hopefully we have better measures for that, and we have more specific measures for adverse effect from health exposure to lead. And so I guess those are things to be keeping an eye out for. So there's at least a start of an answer to that.
Thank you for that. And oh, sorry, Ryan. Yep, you go.
I'll just follow on from that, saying that, yeah, no, definitely what Peter was saying. I've seen some workplaces that have set some targets, you know, so they make them lead to be down below 10, you know, and getting workers really involved in trying to, you know, minimise that. In some places, there were incentives to get it below 10 as well. And from what I've seen, at least personally, that seems to be quite effective.
Cool. Thank you, Ryan and Peter, for that one. We're going to, I think, finish up here. So if you do have any additional questions, you can see that there's some channels on our screen there. So we've got our SafeWork number and email address, and also SA Health got Razi's email and phone number there. So if you do have any additional questions or anything like that, or anything a bit more technical, please feel free to send us an email or give us a call. Thank you very much for joining us today and for your participation. We really hope that you found this information useful and that you can take something away from today. A huge thank you again to our presenters. So Ryan Czakowski from SafeWork, Dr. Peter Jezikaitis, and Razia Zarif from SA Health. We appreciate all your input and for taking the time to present today. Yeah, again, that's all from us here. If you have any further questions or want to discuss anything further, please direct them to the channels on our screen. I'll also just say that this webinar has been a part of National SafeWork Month and SafeWork SA's initiative and events that we're doing for National SafeWork Month. So we still have a few events to get involved in. We've still got a few weeks left of October. So if you are interested in having a look at what else SafeWork SA is doing to celebrate National SafeWork Month, head over to our website. There's a page that's got all our information in there about all our different events. Anyway, thank you very much again, and we'll see you next time.